CBS News medical contributor Dr. David Agus is here with more on the worsening pandemic. David, good morning. We're less than 60 days away from when most schools would traditionally open, and it's becoming a contentious issue. From a medical perspective, what needs to be the main consideration in deciding how schools will operate?
Well, there are a lot of variables that go into it. Number one, by far and away, is how many cases in your area. If you're in an area with a dramatically increasing cases, it is difficult to consider opening schools. But you need to get the schools ready. You need to be able to social distance. You need to normalize wearing a mask. I can't say that enough. Kids will have to wear a mask in school. You may have to change some of your class time so that you can have fewer kids in the class to social distance. But it takes resources, and we have to work on it now in preparation for September.
We saw a lot of surge this week in the case numbers, but then the death rate also was lower, wasn't surging at that level. Dr. Fauci said not to make too much of it, that it's a false narrative to make too much of that. How do we then put this into perspective?
Well, this is a really important point. I think one that's normally misunderstood. First of all, there's a delay from when you get sick to when you die. And then there could be up to a 4-week delay from when you die to the death certificate being registered at the federal and state level. So that's a big delay. Number two is we're getting better at treating cases. So the hospitalization rate is going down. Number of people who get off a ventilator is much, much higher. The people who are younger who get it, and we're testing more. So those four things are the reason there's a change in the death rate.
Doctor, we've seen a number of these states that have experienced surges either pause their reopenings or in some cases take a step back. So realizing it's one nation sort of with 50 different policies right now, how should states handle their reopenings moving forward?
That's what's difficult, is that no matter where you are, in different places have different policies. And so the key is behavior. If people are wearing a mask and social distancing, cases will go down. If they're not, they won't. And so sometimes you have to enact stricter rules in order to make that happen. Closing bars, closing places where people can get together and where the virus can spread. And so mayors, governors have to step up and be aggressive here. We have to normalize behavior in order that this virus doesn't spread. If we all wear a mask in 3 weeks, there would be no virus.
It's amazing to hear that, to think that people still aren't wearing a mask, but they are not. The World Health Organization issued a new report talking about how the virus is spreading. Are we learning more about the transmission beyond, obviously, the wearing of masks?
So the majority of spread in this country is droplets, which masks block. There is aerosolization, which is virus that can stay in the air. We don't know that's the cause of spread or significant spread at all, but it is something that is taken under advisement. And the WHO says now that it definitely is, we don't know it's causing, but it will be studied. And that's a change in their policy, but it's not a major cause of spread right now in the country.
Okay, Dr. David Agus, thank you once again very much.